Are we ready to begin, Amelia?
Yes, we are whenever you are.
Okay, thank you. Good morning, Councilmember Shea. How are you?
Good morning. How are you?
Good, thank you. All right, we're ready to start. I'll kind of gavel down. Good morning. I am at-large Councilmember Anita Bonds, Chairperson of the Committee on Housing and Executive Administration. Good morning, Councilmember Shea. How are you?
Good morning. How are you?
Good, thank you. Are we ready to start? I had begun the hearing. Is there some issue? Now
No,
the
it's-
recording starts. Should I begin the hearing?
I think it's been recording. Anthony? Yeah, go ahead, Councilmember. You can continue.
Good morning, everyone. I'm at-large Councilmember Anita Bonds, Chairperson of the Committee on Housing and Executive Administration. The time is 10:05 a.m. on Tuesday, October the 11th, 2022. We're meeting virtually via Zoom to convene a public hearing on Bill 24-0996, the Senior Nutrition and Wellbeing Equity Amendment Act of 2022, which was introduced by Council Members Gray, Brooke Pinto, and me on October 11th. Which was introduced by Council Members Vincent Gray, Brooke Pinto, and myself. This hearing is also streaming live and recorded on the committee's YouTube channel named HEA Committee. Some of you may remember that I held a hearing on the No Senior Hungry Omnibus Amendment Act, authored by Councilmember Mary Shea on February 14th, 2022. And my intention was to pass that legislation because I know the need to improve senior nutrition and address hunger. Unfortunately, after many months of working to get a fiscal impact statement, it has not materialized because the hearings and the records lack agency contribution to understand how much it would cost to implement the bill. You may recall that the bill tasks included the Department on Aging with a series of responsibilities, including establishing a task force that would establish a communications plan and screen clients, and the Department of Human Services to allow expanded access to SNAP enrollment system, and the Office of State Superintendent of Education to provide outreach to adult daycare centers eligible for the Child and Adult Care Food Program, and the Department of Healthcare Finance Establishment Act of 2007 to require reimbursable services under the EPD Medicaid waiver to include home delivered meals, nutrition supplements, and medical nutrition therapy. Because I am mindful and care about the nutritional needs and overall well-being of our senior population, I introduced this bill today to address community overall needs. As much as we have done and continue to do since the pandemic, we still have neighbors who are hungry, and I hope to identify areas of success and improvements, particularly related to nutrition services and the overall livelihood of our seniors. One of the solutions to improving nutrition is not to only provide food access, but to also make the public aware that resources are available within their means to get to those resources. In the past and presently, many people who are not connected to the government in one way or another are unaware of the many programs and services that are funded to serve the communities. Accordingly, this legislation was developed in collaboration with the Department on Aging and Community Living and takes a comprehensive approach to addressing senior nutrition and well-being equity in the district by tasking the department to 1, establish and implement a senior nutrition and well-being data collection and reporting plan for the purpose of improving services. It also includes coordination with all district agencies relevant to senior programs and services, and collect and distribute information to the public, including by holding at least 4 annual community meetings for public comment and drafting of a plan with public input. It also includes updating the plan every fiscal year and publishing the plan and all updates on its website. Additionally, it includes screening clients for food insecurity and malnutrition and providing approximate references according to or in consideration of the client's meal preparation abilities, grocery shopping abilities, and access to stores and transportation. It also includes screening clients for housing or related programmatic needs and refer clients to approximate government and private agencies. It also includes offer training on cultural competency, common dietary preparations, and meal planning that's best accommodates individuals' needs and request home health care aides, including for persons that depend upon their home care aides to prepare their daily meal. It also includes establishing programs to regularly check participations of the seniors' physical, mental, and emotional well-being with 1 year after the effective date of this act, and promote the programs to all DC seniors and aging residents. And finally, to submit a written report to the Oversight Committee to evaluate the program's operations, successes, and failures during the prior year, and distribute this information and fact sheets that describe available programs and services, upcoming events and activities for all DC residents that are 60 and older, and develop an in-depth resource guide of all the programs and services available electronically and hard copy and placed in DC libraries, wellness centers, health clinics, and fire stations citywide. And finally, it establishes a community-led task force that will advise the department on how to improve senior well-being with a focus on engagement and outreach. And this group shall be composed of 13 members ages 60 and older, representing each ward, 3 members representing the Commission on Aging, and 6 members that are 75 years and older to conduct the quarterly public meetings and draft the annual goals and objectives into a plan. I trust that the department supports this bill and is ready to implement it once we are able to get it passed by the full council and signed into law. And I look forward to hearing all of our public and government witnesses regarding this important issue. And I ask you to keep your remarks today to 5 minutes per witness. And the entire written testimony of all of the witnesses will be a part of the record. So if you have not submitted it, please email it to housing@dccouncil.gov. And at this time, I'm going to recognize my colleague, Councilmember Mary Shea, and any others I do not see, and ask them to make an opening statement. Councilmember Shea.
Thank you, Councilmember. I'm here to say, and I want to put it on the record, that I do not support the passage of the Senior Nutrition and Wellbeing Equity Amendment Act of 2022, at least not without significant amendment. The reason for this is that I believe that instead of passing this bill, the Committee on Housing and Executive Administration should pass the No Senior Hungry Omnibus Bill of 2021, which I introduced over a year ago and which the committee seems unwilling to move. There was, quite frankly, no need for the current bill to be introduced, as it essentially is a weakened version of my legislation. My bill, No Senior Hungry Omnibus Amendment Act, would represent a huge and critically important step toward eradicating senior hunger in the district. Perhaps most importantly, it was drafted with significant input from community-based organizations serving seniors in the district and informed by 6 months of working group meetings attended by those organizations, as well as staff from the district agencies serving seniors. This new bill, the Senior Nutrition and Wellbeing Amendment Act of 2022, was not. It is basically a watered-down version of my bill, and while purporting to address senior hunger, the bill essentially takes element of my bill and strips them of their impact. One of the main issues identified during the many working group meetings I held to develop my bill was that while the district has many programs in place to address senior nutrition, food insecurity rates remain high because many at-risk seniors are unaware of available services or have difficulty accessing them. Existing senior nutrition services often provide limited or no outreach, and the district government does not collect data on which seniors are food insecure and who is accessing services and who is not. And while many agencies play a role in providing senior food services, there is little or no coordination between those agencies and their programs. As a result, far too many seniors are falling through the cracks. My bill gets to the crux of these issues by taking a comprehensive approach to addressing senior hunger in the district. First, it would create this interagency senior food insecurity task force made up of the relevant agencies and non-governmental organizations serving seniors. The task force would be charged with developing a district-wide response to senior food insecurity that would coordinate between agencies and maximize the effectiveness and reach of services. The legislation would also require a district-wide communication plan for seniors and nutrition services to ensure that we are using all available resources and avenues to connect with isolated seniors in need of programming and support. The legislation would also require the district to take several steps to increase SNAP participation among seniors and add home-delivered meals and medical nutrition therapy to covered services under the Medical Waiver Act for elderly and persons with disabilities. Bill 24-0996, this bill, on the other hand, gets rid of the interagency task force and replaces it with an advisory board of local seniors who would advise only the Department of Aging and Community Living. In fact, the entire bill focuses only on ways that DACL can improve their senior nutrition services rather than an interagency coordination to address gaps and redundancies in services district-wide. It also gets rid of the provisions increasing access to SNAP and to home-delivered meals and medical nutrition therapy, all of which are critical to improving senior food insecurity. While I think it's great to find ways to find, that DCL can improve their delivery of senior nutrition services, that alone will not do anywhere near enough to address the issue of senior food insecurity. Further, the new bill discounts the many months of discussions that took place among those with lived experience, advocates, and agency staff, the testimonies of many people who testified at the No Senior Hungry bill, all in support, mind you, and the support of the 7 other council members who co-introduced my bill, including Council Member Bonds. While I have heard reports that DACL was not pleased with the breadth of the responsibilities under the No Senior Hungry bill, they never said so on the record, nor did they offer recommendations for amending the bill, even after I pressed them on it during the hearing. An agency reluctance to take on new responsibilities cannot be an excuse to give up on those plans, especially for something so important as senior hunger. One might ask, why is it necessary to introduce this new bill on senior nutrition as a replacement to my bill? The cover letter to B24-0996 cites the quote unquote complexity of the No Senior Hunger bill and the quote challenges in obtaining a fiscal impact statement, unquote. My bill is hardly the most complex bill passed in the district, and it strains credulity to say that after 8 months, the committee has not been able to obtain a FIS from the OCFO. As chair of the Committee on Transportation, I've moved and obtained fiscal impact statements for bills easily far more complicated than the No Senior Hungry bill and involving more agencies. I'm therefore compelled to believe that this was an excuse to cover for misguided and unfortunate capitulation to agency apathy. Never mind that this committee could have simply moved my bill as amended to match the bill before us today. A new introduction is just more cause for delay. For these reasons, as I said, I cannot support this bill today as it currently reads. I sincerely hope the Committee on Housing and Executive Administration will reconsider moving my bill, as consideration of this new bill only further delays the implementation of measures that are so desperately needed by seniors in our district. Thank you very much.
Thank you very much, Councilwoman Che. And now we will call forward the public witnesses. And thanks to each of you for taking time out of your day to share your perspective on this legislation and on the issues that the bill aims to address. And I can assure you that the information that we have shared with the public regarding the lack of a fiscal impact statement is in fact the truth. So now let's start with our public witnesses. I
We
think
only
we
have one right now. Ms. Wendy Houston is not able to appear. I think she's waiting for a colleague to join her. So right now we only have Dr. Bill, is it Dietz?
all right. Well, we have Ms. Hurston's written testimony, so we can move right to Mr. Dees. Good morning and welcome.
Good morning, Chairperson Bond and Council Member Che and staff. I'm Dr. Bill Dietz, Chair of the Redstone Global Center for Prevention and Wellness at the George Washington University School of Public Health. The views expressed in this testimony are my own. Thank you for holding this hearing regarding the critical issue of senior nutrition. I understand that this legislation was introduced to simplify the previously introduced B24-0996, the No Senior Hungry Omnibus Amendment Act of 2021. I respectfully request that the committee move forward with that original legislation instead of the bill under consideration today. Senior food insecurity is a major issue facing the district. The most recent State of Senior Hunger in America report found that the rate of food insecurity among seniors in the district is 13.1%, the highest rate of food insecurity among seniors in the country. Thousands of our seniors lack consistent access to enough food for an active, healthy life. Food insecurity has heightened the health risk for seniors. Older adults already consume fewer calories and nutrients, making them more susceptible to wasting and putting them at nutritional risk. There are strong associations between food insecurity among seniors and poor health outcomes, particularly for diet-related conditions such as high blood pressure, diabetes, and heart disease. Food insecurity has also been linked to medication underuse, which may lead to complications of disease management and treatment. Recognizing the severity of this crisis, a working group of representatives from DC Council, DC agencies, and many community-based organizations met for 6 months in 2021. Their work informed the No Senior Hungry Omnibus Bill, the comprehensive legislation that you introduced along with 7 other council members last September. The legislation under consideration today, while it concerns some of the same issues identified by the working group, does not address the central finding of our seniors and advocates on the ground, that the district is operating under a major lack of leadership and planning for tackling food insecurity among seniors. With many senior hunger programs already in place, the district abounds with resources. The Council Budget Office has identified 14 separate nutrition programs serving seniors across different agencies. However, because there's no central coordination among our agencies, it is unknown whether these programs serve overlapping clients and who is being missed. The centerpiece of the No Senior Hungry Omnibus Bill is the establishment of a DACL-led interagency senior food insecurity task force to include representatives from DHS, DHCF, DC Health, OSSI, and OP, non-governmental organizations, and seniors with lived experience. This task force would advise DACL and the mayor on policies to address senior food insecurity, prepare a senior food security plan that would identify all currently available services, make recommendations for where services, outreach, and resources should be created, expanded, or consolidated, and improve the nutritional quality of food served to seniors. Today's bill falls short of the original in several key respects. It eliminates the interagency task force and instead creates a community task force of seniors to advise DACL on how to improve senior well-being. While we support efforts to obtain more feedback from seniors, this task force would not address the need for coordination between district agencies. The interagency task force in the original legislation made space for senior representatives, and the committee can achieve its goal of enhancing senior engagement by adding more senior positions to that entity. The bill also eliminates any requirement for a government-wide strategy. It includes no specific requirements for agencies beyond DACL, such as requirements for increasing senior SNAP participation. It includes no increase in adult care participation in CACFP, and no expansion of services in the EPD waiver to include home-delivered meals, nutrition supplements, and medical nutrition therapy. In addition, and a very important concern to me, it eliminates requirements to improve the nutritional quality of meals provided to seniors. Unfortunately, by introducing a separate bill rather than proceeding in the normal markup process, those of us looking to support this effort are left without a rationale for the elimination of these provisions. In closing, we urge you to heed the 45 people who provided testimony in February and move the No Senior Hungry Omnibus Bill, incorporating their recommendations. We recognize that a more comprehensive bill may be more challenging to implement, but senior hunger is a complex problem that requires a comprehensive solution. Because the district boasts the highest rate of senior food insecurity in the nation, a bold and ambitious response is not only necessary, but vital. Thank you for the opportunity to testify, and I'm happy to answer any questions.
Thank you, Dr. Dees, for your testimony. I appreciate hearing from you, and let me again indicate that this so-called substitute bill that we're looking at today was really designed to incorporate as much of the substance from the original No Hungry Senior Bill that was authored by Councilmember Shea, and with hopes that we could get a fiscal impact statement. That is a requirement for all of the bills that we move forward at the council. And believe it or not, we have tried over the last few months to get such an impact statement. And as recent as 8:20 this morning, we still do not have that. And so this new bill, 996, was proposed in earnest to at least move the ball forward so we would begin to address the issue of hunger amongst our senior population. No one cares more about that than those of us who are on a daily basis have to, prepare and help others who are seniors have nutritional meals and have access to their meals. So I appreciate your comments, and they're all taken to heart. I did want to ask you, you indicated that the issue of eliminating an interagency task force is tantamount to diluting the original concept for the hunger bill. Can you elaborate a little bit about that?
It seems to me that the that the replacement for that task force that you've introduced has less accountability and less authority to really push on the issue of food insecurity among seniors. And I think that the composition of that group is important, but why I don't understand why that group should displace the group proposed in the original bill.
Okay, I appreciate that. And some of the feedback that we got on trying to get the fiscal impact was related to the agencies being responsive enough so we would have a financial cost that each of the agencies would bear. So that was part of it. And it continues to be an issue. So I just wanted you to to know that that was the issue.
Yes, I understand the need for a fiscal impact statement. I think that, and you know, you are certainly more familiar with the ins and outs of how that's obtained, but it seems to me that this issue is sufficiently widespread. The senior hunger is sufficiently widespread that it's worth pushing on that fiscal impact statement, despite how complicated it may be. I mean, to me, the absence of this in your current bill means that the lack of coordination among the 14 agencies or the 14 groups within agencies is going to continue, and there's not going to be any leadership, which I think is critical for this issue, which spans so many different groups within government and within DC, among NGOs and so forth.
We don't have actual estimated cost of the bill, but the agencies have indicated, you know, some exorbitant amount. We'll continue to push as is the plan, most definitely. And we agree that the original bill has great merit and should be come law, but we're at this point where we can't get past this hurdle, or we have not been able to get past the hurdle yet. So I just wanted you to know that. The other question I had relates to, you mentioned that the original bill supports 6 months of work coordination between the private sector and the government agencies on pulling together the information that is critical to address senior hunger. Can you give us, I'm assuming you were a member of that body, can you give us some sense of what were some of the glaring issues that surfaced during those deliberations?
Yeah, I was not a member of that body.
Okay, all righty, thank you. All right, well, thank you very, very much, and thank you for your testimony. And I'll turn now to Councilmember Shea.
I'm sorry,
Thank you,
Councilman. Just really quick,
What?
Abby Bluestone is here in place of Winnie. Just to flag that.
I thank you. I see DC Greens on this, but I wanted to turn to Councilmember Shea. Okay.
Okay, thank you. And Dr. Dietz, thank you very much for your testimony. And you identified, I think, quite well the major deficiencies in the current bill compared to what was put together over all of those weeks, months of dealing with agencies and others. But I want to say, in terms of this issue about a fiscal impact statement, your point is also well taken, that while you don't know the ins and outs of this, what you have to do is you have to sit on the agencies to get you the information so that the OCFO can do it. That is not an impossibility. That, I think, is an obstacle that can be overcome and should be overcome given the importance of what we're doing here. In addition to which, the agency's non-responsiveness would not justify the other things stripped out of this bill: the expansion of SNAP, the improvement of nutrition requirements, and all the rest of it that is part of a comprehensive bill to address the extraordinarily high percentage of food insecurity among seniors that you mentioned, and highest in the nation. So I still cannot accept that we should go with this watered down, apathetic piece of legislation in view of, take on the one hand that, in view of the enormity of the problem that we're trying to solve. So there's not a question there. I just wanted to thank you for your testimony, and I appreciate your reiterating the flaws in this bill. Thank you, Chairman Bonds.
Thank you very much, Councilmember Shea. And we have now been joined by Ms. Bluestone representing DC Greens, and we'll receive your testimony now. Thank you.
Thank you. And good morning, everyone. I am reading testimony on behalf of Winnie Houston, who is DC Greens' food policy strategist. Good morning, Chairperson Bonds and members of the Committee on Housing and Executive Administration. I am Abigail Bluestone, reading on behalf of Winnie Houston, and I represent DC Greens, a nonprofit in DC that works to advance health equity by building a just and resilient food system. I come before you puzzled and disappointed by this committee's introduction of the Senior Nutrition and Wellbeing Equity Amendment Act of 2022. I ask, why are we spending taxpayer funds on moving a piece of legislation that tasks the Department of Aging and Community Living with doing the work it should be doing anyway, improving its operating processes, implementing strategies to regularly communicate with seniors, getting input from seniors on how to improve services, and reporting on these efforts to the mayor and the council. We must tackle senior food insecurity head on. It is a persistent and growing problem that is negatively impacting the health, quality of life, and independence of DC seniors. The latest data on the state of senior hungry in America shows that DC continues to have the highest senior food insecurity rate among US states at 13.1%, an increase from 9.6 in 2016. This means that approximately 15,000 seniors lack consistent access to enough food for an active, healthy life. Although we don't have a complete picture of the impact of the COVID-19 pandemic on senior food insecurity, we do know that seniors are using nutrition services at a higher rate than before the pandemic. Research shows that the number of seniors facing food insecurity will grow in the coming decade, as the senior population is expected to increase by over 20,000 by 2030. The time has passed for piecemeal approaches to addressing senior hunger. We must stop making excuses for failing to take necessary steps to address this crisis facing some of our most vulnerable residents. This committee should shelve this toothless senior nutrition bill and focus on getting seniors the help they need by moving the No Senior Hungry Omnibus Amendment Act of 2021. The No Senior Hungry legislation was informed by 6 months of research by a working group of representatives from council offices, district agencies providing nutrition services, community-based organizations serving district seniors, and seniors themselves. At the public hearing on the No Senior Hungry legislation, 33 seniors and community groups testified before this committee on the importance of passing the bill, which takes a comprehensive approach to addressing senior food insecurity. Government agencies must be identified and specifically tasked with actions to make it easier for seniors to access nutritious food and nutrition services. The major provisions of the No Senior Hungry bill require that the Department of Aging and Community Living, Department of Human Services, Department of Healthcare Finance, DC Health, OSSI, and the Food Policy Council to work with community organizations that serve seniors and impacted seniors to develop a plan to improve the city's response to senior food insecurity. DHS to increase senior SNAP participation, implementing ESAP created a standard medical reduction to simply the collection of medical expense information, allow community-based organizations to access the SNAP enrollment system on behalf of clients, and implement senior targeted outreach for online SNAP. OSSI to create or to increase adult daycare participation in a federal program that provides reimbursements. DHCF to expand covered services under the Medicaid program designed to provide seniors and persons with physical disabilities with home-based healthcare services, home-delivered meals, nutrition supplements, and medical nutrition therapy. We must work together in a coordinated effort, government agencies, the private sector, and community members to build effective systems to address the needs of hungry seniors. A bill that asks one government agency to do a better job of providing core functions is not the answer. Doing what's right is often complicated and requires elected officials who hold the sacred power conveyed by voters to have the political will and the strength of character to do what's difficult. Frederick Douglass said, "If there is no struggle, there is no progress. Power concedes nothing without a demand." You have the power to task DHS, DHCF, OSSI, and DACL to simplify processes and to take advantage of federal resources in order to provide more robust services for seniors in need. I call on you, Madam Chair, to lead this committee, the full DC Council, and the executive to stand up for hungry seniors. Pass the No Senior Hungry Omnibus Amendment Act of 2021. Thank you.
Thank you very much. I don't have any questions. I think the testimony is very clear. And I'll turn it over to Councilmember Che. She may have.
Thank you, Councilmember Bonds, and thank you, Abby. And I know you're reading the testimony, but nevertheless, thank you for your being available to do that. And your testimony was comprehensive and to the point. So I just thank you for coming. Thank you.
Absolutely. Thank you for having me.
Thank you very much. We will now hear from the government witness, the Director of the Department on Aging and Community Living, Interim Director, in fact, Jessica Smith. Is Director Smith? Yes, she's here. Okay. All right. Okay. Ms. Smith, I'll swear you in now, please. Would you raise your right hand? Do you swear and affirm that your testimony and any statements that you make before us today to be truthful and complete?
I do.
Thank you. And you can begin when you're ready.
Good morning, Chairperson Bonds, Council Member Che, members of the Committee on Housing and Executive Administration and staff. My name is Jessica Smith, and then I'm the Interim Director of the Department of Aging and Community Living. I'm pleased to provide testimony on Bill 24-0996, Senior Nutrition and Wellbeing Equity Act of 2022. With me today is Garrett King, Chief of Staff at DACL. Before I begin, I'd be remiss if I didn't acknowledge my predecessor, Laura Newland. For more than 6 years, Laura helped shape the work of DACL, and we're incredibly grateful for her leadership and service to our city's older residents, adults living with disabilities, and those who care for them. I'd also like to thank the Mayor, Muriel Bowser, for her leadership and bold investment she's made and continues to make in our seniors. As we begin the new fiscal year, I'm excited to highlight a few of the fiscal year 23 investments our mayor has made for older adults. Chairperson Bonds, Mayor Bowser continues to focus on making sure we're keeping DC a safe and affordable place to live for all residents, especially our seniors. This fiscal year, the mayor's Fair Shot budget includes a $40 million package of legacy initiatives that will help our seniors stay in DC, in part by making it more affordable to own and maintain a home. One of the investments is a 2% senior property tax cap designed to lower the cap on annual increases in property taxes for seniors. Additionally, her budget makes a $10 million investment to increase access to homeownership for longtime Black DC residents, as well as a $6 million investment over 2 years to assist low-income homeowners in repairing and maintaining their homes. With these big investments and so much more, the mayor is doubling down on our efforts to be a stronger, more equitable DC that puts our older residents first. As the interim director of DACL, I'm proud of the work we've accomplished together since stepping into this role, and I'm excited about the work that lies ahead of us. While we've experienced some changes, one thing that hasn't changed is our commitment to seniors. And together, our entire agency is renewing our focus on ensuring we're providing high-quality services and resources to our constituents today, tomorrow, and far into the future. At DACL, we recognize the urgency of this bill and support its intentions to improve the implementation of nutrition and well-being programming, create mechanisms to regularly check on seniors' health and safety, distribute quarterly mailers, expand our direct engagement with seniors, and ensure professionals and community members have access to the senior-specific training they need. The need for greater coordination and collaboration with the council is critical, and we know together we can further improve how we address nutrition and improve the quality of life for seniors in the district. While we have a ways to go, I want to take a few minutes to highlight what our agency is currently doing to address senior food insecurity and well-being. First, we're working to ensure the collection of strong data is a priority across the agency. We know that data-driven decision-making creates opportunities for greater transparency, accountability, and improved service. I'm excited to share we're bringing on a new chief operating officer, one that has an extensive background in building systems and creating data-driven cultures across district government. And in addition to bringing on a strong COO, we're focused on building a team who will ensure our agency and our grantees are making the data-driven decisions our community deserves. This data will help accomplish the intended goals of this bill by guiding us in the creation and restructuring of our programs and outreach services. Further, our Future of Aging initiative, which started last winter, is laying the groundwork and building a foundation to sustain a data-driven culture at DACL that's driven directly by our residents. This past summer, our Future of Aging team spoke to more than 400 community members, including seniors from every ward, adults with disabilities, and caregivers at library workshops, our senior wellness centers, grocery stores, and during virtual outreach events. Through these unique interactions, we bettered our understanding of the level of diversity that exists in our senior community. This is also a community that desires to connect with DACL in ways they haven't before, like through text messaging and social media platforms. We've also learned that our community knows about our services and considers DC to have some of the best services around. With that being said, the issue that was consistently brought up by our seniors and viewed as one of the most critical is transportation, often referred to as the link to everything our seniors need and want: healthcare, food, socialization, to name a few. And while we know transportation is a critical need in the district, we also know that senior hunger and food insecurity is a complex issue and one that none of us take lightly. The U.S. Department of Agriculture defines food insecurity as the lack of consistent access to enough food for individuals to lead an active and healthy life. And across the country, we know that these past 2 years have likely only exacerbated this complex issue of food insecurity among older adults. But in a city like ours, with a mayor and council who is committed to combating both senior isolation and hunger, we know we can do better. That's why we partner with the National Foundation to End Senior Hunger to dig into DC-specific data, compare what they find to national trends, and review nutrition equity and food quality in our senior wellness centers and community dining sites. Through this partnership, we're focusing on addressing nutrition and health gaps while working to develop new strategies and programming that will ensure our sites are helping seniors live healthier lives. We're excited to see the data this partnership will bring and confident we can move our needle forward in combating senior hunger in our city. One factor we've observed as contributing to senior food insecurity is getting to and from the grocery store can be a barrier in and of itself. One of the ways we're helping seniors have greater access to nutritious foods and so much more is through our Connector Card transportation program, which is receiving a $1 million investment in this fiscal year to expand transportation availability. To date, more than 2,000 seniors are enrolled in the Connector Card program, and our team is focused on signing up even more. And we aren't just helping seniors get to and from the grocery store, doctor's appointments, and other points of interest. We're also launching a program that's going to give 450 qualifying seniors the autonomy to choose the types of foods they want. Thanks to the mayor's $750,000 investment, this fall, we're launching the Food for Choice Grocery Card Pilot. Through this pilot, seniors will receive monthly grocery funds, nutrition education resources, and ultimately make their own nutritional decisions. And to ensure every program is data-driven, we'll be testing the impact these nutritional decisions have on seniors' physical and mental health. In addition to Food for Choice pilot, Chairperson Bonds, you may recall the senior nutrition program we launched in fiscal year 21, Eat Well, Live Better. In partnership with Mary Center, this program delivered grocery boxes twice a month to participants, as well as individualized nutrition education and coordinated care with their healthcare providers. And as a result of the mayor's fiscal year 22 investment of $646,000, we're able to continue this program in fiscal year 23, having served 911 seniors and delivering more than 16,500 food boxes to date. Creating programs to give seniors choice, autonomy, and access is a huge priority for DACL. But we know that the Food for Choice pilot and using the Connector Card program to get to and from the grocery store is not possible for everyone. That's why, for those who have to remain at home, we want to make sure they're getting more than just a home-delivered meal. Through the mayor's $2.6 million investment in tablet distribution and technology resources, we're able to ensure homebound older adults have access to the broader community. We've expanded our home-delivered meal program to not only include meals delivered right to seniors' doors, but devices that provide a direct connection to a DACL nutritionist and the opportunity to participate in a virtual dining site and wellness center that will feature virtual programming specifically designed for older adults with limited mobility. All of these features will be available on the new DACL mobile phone application. So if you head over to the App Store on your phone and type in DACL, you'll see one of the newest ways we're meeting seniors where they are and further bridging the digital divide. As we continue to move the needle forward, we're also working with the lab at DC and the Age-Friendly Nutrition Task Force to create a food access tool that will foster coordination and collaboration amongst the several organizations across the district that work to meet residents' nutritional needs. With this tool, we're getting seniors on the right nutrition programs, maximizing the way seniors and other residents are benefiting from all the nutrition services our city has to offer. And by working together, we can identify the gaps and combat food insecurity head-on. Madam Chair, the mayor often says it doesn't matter if we have the best programs in the world if no one knows about them. That's why we're zeroing in on our communications and outreach efforts, both internally and externally, because we agree with you and this bill that we could do more. In my role as interim director, I spent several hours per week in the community. From Ward 8 to Ward 3, our outreach team has been focused on meeting seniors where they are, hosting the mayor's annual senior symposium, visiting senior housing communities, connecting with seniors at local grocery stores, and attending community citywide events like the 8th Street Festival and MPD's National Night Out. And we're excited about how this bill will expand our outreach to seniors through more mailers and wellness check programs. In addition, we've been heavily engaged with our network of DACL ambassadors and the Commission on Aging, provided the latest information regarding programs and services, and working closely to design and implement services with them and their peers in mind. And we're coordinating with our sister agencies across district government, hosting lunch and learns twice a month, where we're sharing information on how our colleagues in other agencies can support our city's older residents. We recognize the importance of ensuring our sister agencies and community partners have the information they need to effectively serve our older residents. As we move forward, we're keeping the well-being of older residents at the forefront of our work. The mayor continues to make historic investments in our seniors, and with the fiscal year 23 investments focused on access, affordability, and equity, we know that we can continue to create a DC where our seniors are living healthy and thriving lives. Thank you for the opportunity to testify before you today. I'm happy to answer any questions you might have.
Thank you very much for your testimony. The mouse and I are not working well together. Okay, all right, thank you. All right, trying to get my mouse operating well. Okay, thank you for your testimony. I have a couple of questions as it relates to just information that you have provided us with. And I'll start with the last piece that you mentioned, and that is you're coordinating with sister agencies across the district government, hosting lunch, learning twice, a month. You're sharing information about the challenges. When you have these sessions, what is the real goal? Is the goal to educate these agencies as to the importance of being involved in the No Hungry programs, or what is the goal?
Yeah, that's an excellent question. And I would say it's twofold. One, it's to ensure that DACL and all of our staff have the information that we need to provide our seniors who we're working directly with the correct information. So just 2 weeks ago, we had the Department of Human Services come in and give our entire staff a training on SNAP enrollment. Because I think no matter what your role is in the agency, you should have the information on how to fill out a SNAP application so that you can help a senior fill that application out or help them understand the eligibility criteria and point them in the right direction. So that training, as an example, was focused on ensuring our staff had the tools they need to pass along to our seniors. However, we also host trainings with district agencies. We did a training with the mayor's office on returning citizens on the services that DACL and our network provides, because they actually are working with a lot of returning citizens that are seniors. And so we wanted to make sure their staff had the information they needed to refer people to the Connector Card program, for example, and our home delivered meal program. And so all that to say, it's twofold, that we're informing each other on what we're doing and how seniors can benefit from those services.
I appreciate hearing that. You mentioned in your testimony a number of programs that your office is engaged in as it relates to outreach to senior population. And you also mentioned that you are doing meal delivered right to seniors' doors, but devices that provide a direct connection to a DACL nutritionist. When we talk about food and food insecurity, immediately you think of groceries being delivered or groceries being picked up at a store by a individual. When you tell me that you're in the business of using devices to connect seniors to nutritionists, it doesn't help us understand how we get the nutritional food to the resident. Can you give us some insight as to how this works with devices and nutrition and what have you?
Absolutely. So specifically, the devices that I was talking about are actually for our home delivered meal clients. So we're already providing them with meals each day for them to be able to access. But in addition to that, we wanted to ensure that we were providing them with resources to be able to engage with their community and learn more about their nutritional health, because we don't want to just give people a meal and then leave, right? I don't know if they're even eating that meal. I don't know if they have the ability to take ownership of their nutritional health. So this is a way to supplement that. In addition to the meals, because our home delivered meals are for people who are homebound, the assumption is they aren't able to get out to our senior wellness centers, our community dining sites. And so we're bringing that to them in their home by giving them a device, which is accompanied by Wi-Fi and technology support, of course, and it allows them to be able to tune into a virtual dining site, connect with a nutritionist about their health, talk with other seniors, and engage in programming specifically designed for homebound residents. So it's a supplement, not a substitute.
Okay. One of the provisions in the original bill authored by Councilmember Shea includes the opportunity for private sector vendors to come together and to discuss and determine what should be the progress as it relates to providing nutritional meals to the senior population. What is your take on that from the perspective of how can DACL be involved in that? Or is DACL already involved in that?
Yeah, I would say that we are, but we certainly can continue to engage different groups of people. We've yet to meet someone where we've turned away, where we're able to include anyone who wants to join our forces to end senior hunger. Right now, we've been working with the Age-Friendly Nutrition Task Force because it was a group of a lot of our stakeholders anyway. Instead of creating a new group, we're using that as a platform to collaborate with all of the different stakeholders in the nutrition space to build this food access tool, which will do really what I think the bill, both bills were intending to do, right? Which is coordinating and collaborating to ensure that we're all working together to refer people to the right resources. Instead of having a senior have to go and apply to 10 different nutrition programs, we'll bring a tool in that will assess them in a holistic way and be able to refer them to the nutrition programs that best fit their needs. And each one of our nutrition partners will be able to administer that tool. So there'll be really no wrong door when it comes to connecting with nutrition services. And we're excited to work with the lab at DC to develop that tool. to make sure that we're doing it in the most efficient and equitable way. We're also working with the National Foundation to End Senior Hunger, which is working with a lot of our national partners as well.
Okay. So, Jessica, are you telling us that you're already working with those entities that provide nutritional content to seniors? You're working with them in a collaborative manner to be more intentional as to the results that we get? Is that what's going on?
Yeah.
I'm trying to understand this because
Absolutely.
there is
Yes.
some concern that, the new bill, the one we're examining today, 996, is a watered down version of the original bill and somehow leaves out input from these entities that have had a say in the marketplace for years in providing nutritional food content.
Yeah, I would put your mind at ease and let you know that we are absolutely coordinating with other entities. We know that DACL cannot do this alone. To your point earlier, we administer home delivered meals. Not everyone needs a home delivered meal. We rely heavily on our partners in the community for all the amazing nutrition programs that they provide, and we're working with them on a daily basis. In addition to working with them, though, I would note that our Future of Aging initiative has really opened the door and how we're engaging with our seniors directly and how we're taking that information and making meaningful changes to our programs and supports, because we want to, in addition to hearing from the experts and our partners in the nutrition space, we also want to make sure our programs are responsive to what seniors are telling us, how they want to access programs, how they need the support to meet their needs. So we're doing that as well.
I also wanted to get your any feedback on some of the comments that I get going to the senior buildings and establishments, talking with seniors out in the general public, even in front of grocery stores, is that the food substitutes that they get or the food supplements that they get from the various entities that are providing these meals is frequently the same. And a lot of it is, the starches. And when occasionally they may get the greens. And so it seems that there is inequality amongst the providers as it relates to what they have in the way of food stock that's shared with our senior population. Have you had any discussions with those entities about the quality or the type of food materials that they provide?
Yeah, absolutely. And you're not alone in hearing that feedback. We certainly hear that as well. And we are working to better hold our vendors accountable to the food that they provide our seniors. We recently brought on 2 nutritionists that are in charge of working with our vendors, reviewing menus ahead of time, reviewing dietary requirements before the menus get published. And in addition to that, they're actually going on site to ensure that what the vendor has said that they're providing to us actually translates to the dining site, and that's actually what's being provided. They're engaging with seniors in person to collect feedback on the food that's being received, collecting comments from the comment boxes. Many of our dining sites have comment boxes, so they're collecting that. And one of the reasons why we had the taste test for the new contract, which included seniors from every ward, was to be able to try to hold our vendors more accountable. That's also why we have 2 vendors this year instead of 1, trying to make sure that we can improve the quality. We certainly see that as a priority.
All right. Well, I thank you for that response. I've been very, very concerned, when I'm talking with people. So thank you very much. I'm out of time. I'm going to turn to Councilmember Shea for her questions.
Thank you. Thank you, Councilmember Bonds. Director, in terms of this bill and your testimony, you described a whole litany of things that you're doing. I mean, a whole bunch of things. Great. So is there anything in this bill that you don't already have authority to do and should be doing?
Well, there's a
Pick
couple.
today.
Certainly. So there's a couple different aspects of this bill that we're looking to lean into more. One is the piece around outreach. We're not currently doing quarterly mailers, and so that's something that we would start in addition to this bill. There's also data requirements in this bill that we're not currently reporting on a regular basis to council. There's a component of training. Like I mentioned, we are doing a lot of engagement with our sister agencies and community partners, but we're doing that of our own volition. And so this would have some requirements around some of that, as well as some additions for the way we're engaging with physicians and other outreach mechanisms, and some health programs, some
But
safety
you
and
already
health.
have the authority to do all of these things. I take it from your testimony about all the things that you are doing, that you have the full authority to do all of these things. Or are you saying you don't?
It
Is my understanding that we can engage in these areas, yes.
Okay. And then a question about the fiscal impact statement. What is it about coordinating with multiple agencies that actually incurs a cost, since you're saying that you do that also?
I'm sorry, can you repeat that?
Yeah. What is it, in terms of the FIS, what is it about coordinating with other agencies that incurs a cost, especially since you say you're doing it already?
Are you talking about for this bill or for the previous?
No, I'm asking a general question. What is it about coordinating with other agencies, something you say that you're doing already and you want to enhance, that incurs fiscal impact?
Well, it would depend on specifically the type of coordination, but I can speak from my role in the deputy mayor's office previously, which was specifically around coordination, that a lot of times when you're getting different agencies together, there is a big need for specific FTEs that would do that coordination work. There's oftentimes a lot of reporting and readouts, research that goes into that. So without knowing the specific pieces that you're referring to, I would say the coordination role can include specific FTEs to engage in that work.
Right. And agencies such as your director, right? So, I mean, agencies can figure out what the FTE requirements are and what the cost of that is, I assume. Is that correct?
Yes.
Okay. And then you also mentioned a lot of money that has come your way from the executive. And so apparently whatever coordination you're doing now, you're able to pay for. Is that right?
We are, yes, we're using our current budget to engage in the coordination that we're currently doing.
Okay. And your plans to work with other agencies and all of the other plans that you cited. Again, you heard the percentage of seniors who are food insecure. How is it that we still have this most serious situation? You had the authority that you need. You have all of these programs and plans. So how is it we're stuck in this very, very awful position with our seniors? How is that the case?
I think there's a couple different reasons behind that. One, I think that we need to dig into the data further, which is why we brought on the National Foundation to End Senior Hunger. They're going to actually be working through the methodology that was reported in the Feeding America report and with Dr. Zielinski, who was the author of that report, to try to get a better understanding, comparing it to US Census data, et cetera, and comparing it to national trends. So I think first we need to really dig into the data further and see if there's specific areas that we could be engaging in. Second, I would note that one of the reasons why we at DACL brought nutrition assessment and home delivered meals in-house almost a year ago in January of this year is because we realized there needed to be more oversight, equity, and coordination amongst that program. And we're already seeing the payoff from bringing that service in-house. And then I think also we do need to work more around coordination and collaboration with our community partners. We've certainly started to do that and we'll continue. But I think if we ran the numbers again today, that impact would really show that coordination has made an impact, in addition to all of the new programs we're trying, like Food for Choice and our Connection for home delivered meal clients.
You talked about data. We, over this many months of working with these different groups and agencies, we heard a problem about sharing data among agencies. How will your agency obtain data from other agencies without the first bill? You're just going to rely on their goodwill?
Well, we would enter into data sharing agreements. We recently entered into a data sharing agreement with DC Health, for example. And so if there was information that we weren't able to share without a data sharing agreement, we would work with those other agencies to create that agreement so we could break down those silos and share that information.
And so your plan is to enter into these agreements, but the first bill would require this cooperation. Wouldn't that be better?
Well, I'm not sure I can speak to which would be better, but we certainly are able to accomplish the goal by creating data sharing agreements.
Well, I think you're in a position to think about what would be better, because we're talking about two different ways of proceeding. And then are you aware of the hearing that was held on the first bill?
Yes, I was also there for that.
Okay, and there were no objections from your department about that bill. There was support, wasn't there?
We supported the general goals of that bill.
You supported the bill, did you not?
We supported the spirit of the bill. We did have some implementation concerns with that bill. But yes, we agree that there is senior hunger that needs to be addressed in the district, and agree with the partners that that's something that we need to put our focus on.
Okay, and so what are your plans to implement the gaps in SNAP, EPD waivers, and so on without the original legislation?
Well, both of the things that you just noted, we would need to rely heavily on our partners at the Department of Human Services and the Department of Healthcare Finance for, as both those areas are in their wheelhouses, but we would partner with them. Like I mentioned before, we know that there needs to be more enrollment of seniors in SNAP, which is why we just partnered with the agency to educate our entire staff on how to spread the word on that. So we'll continue to do trainings and meetings and coordination efforts with those agencies as they work through those pieces.
Well, if your department is at the head of all of this, if you had an interagency approach, wouldn't it be better to have that embodied in legislation?
I think that we can continue to work with our partner agencies without it.
The question is not whether you can work without it. Excuse me, but the question is not, excuse me, the question is not whether you can work without it. The question is whether it would be better to work with it. Is your answer no?
No, I think we can accomplish the goals without the legislation.
Wouldn't it be better to have the requirements of the first bill in operation? Would it be better or not?
I don't know that I can answer that. I don't think that that's necessary to be able to implement that, but I'm really here to testify for this current bill. I think that we can achieve the goals that are outlined in this bill, and I'm happy to speak to how we're able to do that.
Well, I think it's important because the earlier bill, you should be able to speak to the goals outlined in the earlier bill and whether that is or is not better. I think that that should be something you would be able to offer testimony on.
Well, with all respect, I am noting that we are able to accomplish what you're saying currently without that legislation in place. So we are able to coordinate and collaborate with our district government agencies to achieve the goals that were outlined in No Senior Hungry without that legislation in place. We offered testimony on that bill, as we've offered testimony on this current bill to the council.
Thank you. My time is up. Thank you, Councilmember Bonds.
Councilmember, you're on mute.
All right, thank you. There is one other area, Ms. Smith, I just wanted to make sure that we're clear on. You mentioned that there is a clear connection between physical health and nutrition and mental, emotional health. I want to know, in your data collection that you're currently doing, what are some of the pieces of information that you're beginning to gather? And this is as we move forward, and the importance of data collection and how we might be able to use it, inform us as to where we can go with this and to make the necessary improvements in the nutrition of our seniors.
Absolutely. So we're taking a hard look at all the data that we currently collect and making sure that we're getting the information we need from the current programs we run, if there's any missing pieces that we need to add to be able to make those informed decisions. And as we set up new programs, for example, the Food for Choice grocery card pilot, we're making sure that we're working with partners and other district agencies and with the lab at DC to really do pre and post tests, not only around health, blood pressure screenings, things of that nature, but also mental health, because we know that there can be a positive impact when we give people autonomy and choice over their nutritional decisions. So we want to make sure that we're measuring folks' mental health in addition to their physical health when we're giving them those choices. One of the pieces that we're also working with the Foundation to End Senior Hunger is through an Age Well pilot. And that's going to be looking at our senior wellness centers and community dining sites and reviewing the food that's provided there, to your point earlier, looking at the health of the residents that are going to those sites and seeing, are we needing to add anything or modify both on the food end and the programming side to increase our health outcomes for people who attend those dining sites.
Okay, and then I wanted to just jump on this. Have you given thought to the number of FTEs that would be needed to implement the legislation we're reviewing today? That's Bill 996.
Yeah, we're taking a hard look at that right now, and we'll be able to follow up with all of that information.
Okay, I would like to get your feedback within 10 days, please. That would be very helpful to us.
Certainly.
And then what is the biggest challenge that the agency would face in implementing this legislation 996?
That's a great question. I think there's a few pieces that we'd like to discuss further in addition to solidifying the timeline. One would be looping in our partners at DC Health to further discuss the requirements for home health aides, as DACL does not currently have oversight of those professionals. So we'd want to loop DC Health in there. As you know, we're engaging with our residents. You've heard that from our Future of Aging work, but we'd want to have a further discussion about the task force just to ensure there's equity, particularly around compensation for those various groups, in addition to our Commission on Aging and senior ambassadors. And then lastly, we're putting a lot of work into our website. We know it has a long ways to go, but we'd like to have a conversation around the goals of the portal, just to ensure we're able to create a system that can also be responsive to the grantee programs, as many of our programs and applications would go directly through one of our partners. We'd want to make sure that we're creating a system that not just works for DACL, but works for all of the folks in the network.
Okay, you mentioned earlier that the idea that you're working on now without the bill is this common application, and that all who are involved in nutrition services would be able to use. Can you give us some idea as to how that would be linked, how the different agencies would be linked?
Yeah, the lab is working to meet with all of our community partners right now to make sure that we create a system that's not overly onerous to all of our community partners, specifically some of our smaller nonprofits. We want to make sure that everyone can access the tool. I can let you know that right now, as of this time, the thought is that we'd be able to have an online system, an assessment that's web-based that people could fill out. It would then automatically score the assessment and let somebody know, based on your unique circumstances, you would best be served by first applying for SNAP, so precursor of everything, of everyone applying for SNAP. And then two, We Are Family or Martha's Table or Capital Area Food Bank. So it would let the person know which programs best fit their needs, because we would have already taken those program eligibility factors into account on the back end. We also know, and we've heard from our community partners, it'll be really important that we have a paper copy of that assessment, that it's not just online based. And so we'll be working to have something that people can fill out, hard copies that people can fill out, and then a way for them to score that manually to give them the same results. The real goal is to make sure that whether you come to DACL or whether you go to Martha's Table, you're getting the same results on the assessment so that you're not missing out on any opportunities for nutrition support.
Okay, and would you, for the audience, in the audience that's listening, would you please explain what is the lab and how the lab works?
Sure.
I think people need to know.
Sure, I apologize. The lab is the city administrator's evaluation arm. And so they're groups of experts that work in this space, data scientists, evaluators that come in and partner with agencies on projects that are going to have large impacts across the district. So we're really excited to be able to work with them on this.
Okay, well, thank you very much. I wanted to make sure we put
Thanks.
that out. Yes. I think that exhausts my questions. Councilmember Shea, do you have further questions?
No, thank you.
All right. Well, thank you very much for your testimony today on this important bill. And so the committee next meeting will be later today at 3 p.m. It'll be a public hearing on the following legislation: Bill 24-653, Period Equity, Writing, and Injustice of District Residents Act of 2022. And this concludes the hearing for today. And with that, the time is 11:23 a.m. on October 11th, 2022, and the meeting is adjourned. Thank you very much. Thank you for your testimony.
Thank you.